I'm Dr. David Fishman. I'm a cardiologist internist. I've been in practice for 35 years. I actually decided to become a physician based on experience with my own family and unfortunate illnesses that had occurred in my parents and grandparents that as a child I didn't understand and felt sort of helpless and unable to do enough to help them compensate and actually feel better. I'm a native Chicagoan. I went to college in Chicago. I went to medical school in Chicago. I did my internship residency in Chicago at the University of Illinois, same place I did medical school. I did my cardiology training at Loyola University and got my master's degree in cardiac physiology from Loyola. My practice is based on two different areas of emphasis. The first is on the diagnosis and treatment of patients who have cardiac diseases, and then a major emphasis on the prevention of those diseases so that the patients remain healthy. And I use my internal medicine background to emphasize healthy practices and healthy aging in the patient population that I deal with, because I think that cardiology has a large percentage of preventable problems, and most of us should be enjoying health, not treatment. I have a great deal of interest and expertise in the specialties of cardiology, which are primarily the diagnosis and treatment, including the specialized treatments of cardiac catheterization, the angioplasty, where blood vessels are dilated and balloons are used to open the arteries, and then the use of stents to keep the artery open in both chronic and acute patients. But I also feel that in the last 10 years of my practice, I've had a very significant interest in healthy aging and the prevention of progress of disease. I think that we should all be living healthier lifestyles, and I've sort of made that a personal as well as a professional interest. I remain current in my practice by two techniques. I have a special interest in patient and hospital quality and patient safety, and I'm on the board of directors of a national institution called the American Board of Quality Assurance, and I help prepare those national programs to provide patient and hospital safety for patients. But I'm also on the education committee of the American College of Cardiology here locally, so I help plan the educational programs for other cardiologists, and I attend national meetings to help disseminate that information locally. So I stay current by means of teaching other physicians as well as myself. My practice philosophy has evolved over the 35 years that I've been in practice. I've grown to where I spend more time in the office and more time with each patient and utilize a physician assistant to help me so that I can spend 45 minutes to an hour with patients on a regular basis, planning not only their immediate treatment but also their lifestyle, behavior modification, whatever it takes to make their health better and prevent them from being ill, prevent them from being rehospitalized. Well, my practice is unique because of my perspective on the practice of cardiology as it's evolved over the years. I think that my attitude is not to an immediate fix, it's not to an immediate solution, but rather an assessment of the patient's current problems, assessment of their needs, and then addressing the entire spectrum of what they need in order to be at the greatest possible quality of life. And I think many of my colleagues are addressing sort of immediate issues, sort of putting Band-Aids on things rather than fixing the problem. The most important thing is that when I see patients and when my office takes care of patients, people feel respected and people feel satisfied, or we keep going until that's the feeling they get. We deeply care about every experience the patient has in contact with us, from the first phone call to when they leave the office, hopefully satisfied and feeling better about themselves.